I am Dr. Joseph Rucker. I'm often asked, why did you become a plastic surgeon? I'm going to give you a quick synopsis of why I did. My grandfather was a physician. My father was a physician. I've always felt it in my blood to become a physician, but I didn't really particularly want to be an internist or a primary care doctor. But I knew I kind of wanted to go into medicine in some form. I loved to draw as a child and as a teenager, and I was fortunate to spend some time in the service at Walter Reed Hospital, where I saw men disfigured facially by trauma, and the great work that the plastic surgeons were doing there. And it all came together. The art part came together with the medicine part, with the reconstructive part. And at that time, the doors just opened and I decided to be a plastic surgeon. Now, what does it take to be a plastic surgeon? Your IQ doesn't, I really don't think it has to be that high. I think that basically you have to be like a badger. You just have to dig in and just do it. You have to do it step by step by step. And when I say step by step, first of all these plaques on the wall, they're very important to me. But the most important ones, I think, were, first of all, getting into med school. I share this story all the time. It took me 29 times to get into med school, but I just kept applying and applying until I finally got in. And once I finally got in, it became a piece of cake. I enjoyed it, and then I set my sights on something else. After med school, I decided to go to a general surgery practice, and I went through general surgery training for 4.5 years. At that time, I decided, boy, I really don't want to do general surgery. I'm going to stick to my guns and become a plastic surgeon. And then I got accepted to a plastic surgery residency program after 5 years of general surgery, and that took 3 years. And we finished that program, and then once you finish the program, you go out and you practice. And I decided to practice in the Midwest, where we have 4 seasons, where it's a safe place to raise your family. And then after doing that, you have to sit down and take some oral boards for 3 days, and you have to take written boards. And once you pass those, you become a member of a society of plastic surgeons. Therefore, you are board certified. I've been board certified since 1984. It's been quite a while. I've seen a lot of things and done a lot of things. Very happy with my work. Very happy with the progress that I've made. And people often ask me, what's your most endearing moment in your career? I can basically say that I did a cleft lip and palate on a young child. I think the child was born. I saw the child when the child was about 3 days old. We had to wait until the child got to 10 pounds. We did a cleft lip and palate repair. Now, as with the cleft palate, it's hard to speak, and your speech can be distorted because of the hole in your palate. So we repaired the palate and the cleft lip. I followed the child for about 5 or 6 years and then lost contact with him. I lost contact with him until I got a invitation for his high school graduation, where he gave the valedictorian speech in perfect English, and that probably was the highlight of my career.